Hey guys, welcome back to The Good, the Bad, and the Truth with Bill with Nandi. As we did last week, we are interviewing professionals, and we have with us our friend
Matt Fortino.
All right, Matt. So welcome to the podcast. And today, to start the podcast, the first thing we're going to do is play a 1 minute game. So what I'm going to do is we'll count a minute, and I will do fire questions on you.
All right, bring it on.
All right. All right. Do you have to wear scrubs?
I can.
Do you have to be in the office?
Not always, no.
Do you interact with many people?
Absolutely.
Do you have a boss?
I do have a boss.
Do you oversee others?
Not at the point I could.
Do you have to be stationed in one place?
I don't have to be stationed in one place, although it's typically expected.
All right. So that's the minute. So guys, can you tell what he does for a living? Put it down in the comments. All right. So to continue on, the next thing we are doing is we're going to find a little bit more about you. Right? So we're going to go into the good, the bad, and the truth. So which one do you want to start out with about your profession?
Let's go right into the gritty stuff. Let's go bad.
All right, bad. All right, so tell me some of the bad things about your profession.
Some of the bad things about my profession. So, one of the most passionate parts about it can be detracted by a lot of the paperwork that comes with it. You know, I know that can apply to a lot of things, but it's like an essential evil. Something has to be addressed, whether it's for buzzword reimbursement or whether it's for our own accountability. That does eat away at a lot of time for many people who do what I do, but not most.
Okay. What do you want to do next? The truth or the good?
I'm feeling truthful. Let's go for it.
All right. So tell me some of the good stuff about what you do for a living.
Some of the good stuff is getting to work hands on hand with many unique individuals. It depends on the type of, niche you fall into. But for me in my position, I have the opportunity to work with people of all ages, varying demographics. I'm pretty stationary, so it is one geographic area. But as far as the general demos of people, it's a pretty widespread, and that's enjoyable.
Okay. What else do you enjoy about your job?
What else do I enjoy? I get to work with other professionals who work adjacent, but we're not doing the same exact job. So I basically have people to bounce ideas back and forth with. Okay. When it comes to my own scope, there's limits to it. So rather than try to have the guesswork be figured out by me, I can just go over, sometimes even next door, knock knock, ask them what they feel about a case, and take it from there.
Okay. And now let's go into the truth. What is a truth that you've learned as you have went on and did your job?
There is an abundance of variety when it comes to what we can do. When I was in my program studying to work into this field, I didn't even know I could do what I'm doing right now until it's already halfway through my doctorate.
So how did you get into the program?
My current job or the training?
Yeah, so what made you decide to go into the program that you ended up choosing?
Sure. So I studied philosophy, psychology when I was an undergrad. I enjoyed it, did well with it. I figured an easy transition would be to go for a master's in counseling, something clinical, something hands-on, and it was almost like a little try before you buy, before you sink in and bite the big cheese of the doctorate program, which could be anywhere from 4 to 7 years depending on training and specialization.
And where did you decide to go to school?
I went to the school in this place called William James College. It's in Newton, Massachusetts. It's a specialty psych program, and what's really neat about this, and for the PsyD in particular, that's doctorate in psychology, every single year, it's a clinical focus. So they put you in a new spot every rotation. So they basically throw you right in for that hands-on work.
Pretty interesting.
Mm-hmm.
All right. So let's talk a little bit more about the money. How is the money in your profession?
I think the average median salary for America is about $85,000 or so, but there's a lot of variance depending on how you specialize. Neuropsychologists are typically going to cap out at the higher end, anywhere from maybe 120 to upwards of 200,000. And as with most professions, if you're a business owner, you have people working under you, then the sky's the limit, if you will.
Okay. So what is your next objective? What's your next goal?
For me, so I work in primary care. It's all a bunch of physicians, PAs, APRNs, and then I'm the one random integrated psychologist just dropped into the mix. So all the providers there basically do the same thing except me. So I kind of work between everybody, and it's just exciting. But going back to your question of what am I doing next, I'm doing a few lectures for FSU's med school. So the residents work in the hospital, and I do specific topics. This season is on substance use disorders.
It's pretty interesting. So what exactly is it that you do as a clinical psychologist?
So in integrated care, I do assessments, general biopsychosocial intake, try to find what the presenting problem or what the chief concern is for the patient. And because I'm working in a medical system, it is medical. So what are your symptoms? How long? How intense are they going? And most importantly, how are they impacting your life? So I'll give you an example. Someone could be terribly sad, like crippling woe just built up inside them. They wake up feeling down, depressed, but they're still spending time with their friends, their family, their hobbies, all of this. They're going to their job. Well, even though they're sad, technically they're not depressed. It's that impairment that really gets in the way. So part of what I do off the bat is seeing what symptoms are you having, how bad are they, and how are they affecting your life. We need that blueprint to figure out where we can go for step 2.
Okay. So, for example, for somebody like me, I have ADHD. How would you help somebody like me?
So it depends on the presentation. So ADHD, we have 2 types, or 3 types really. Inattentive, hyperactive, or combined inattentive and hyperactive. So for someone like you, I'd probably do a reassessment. See, are you more one side, are you more the other, and figure out where we can go from there. So what would I do? Ooh, well, if I could ask a personal question.
Go ahead.
How does it get in the way of your life? Like, what is the biggest thing that it affects on your day-to-day?
I feel there's 2 ways that I feel like it affects me a lot. One is procrastination, so I procrastinate a lot, and 2, I feel like it affects me whenever I have to take exams. So, for example, when I was getting my general contractor's license, whenever it's an exam that was too long, I can stay concentrated for the first few hours, but after a while, I lose concentration.
So you start to lose steam, get distracted for one reason or another,
Correct.
and also pushing things off.
Correct.
So I'll just jump right ahead. I'll skip a few steps, right? Let's say we're on appointment number 4 and we're already getting into the practical. One thing I'd recommend is something a younger patient said to me, and it still sticks with me. They said, Matt, depression can't hit a moving target. Similar concept for ADHD, but rather than sadness and woe, basically when you go into a new room, don't sit down. The second you sit down, it's so easy to take out your phone, get locked in, and then we lose track of time. It's hard to initiate, even if we actually can sustain once it starts. But giving yourself that opportunity to simply start, whether it's laundry, spending just a few minutes on a homework assignment, that's pivotal, because we can't have anything else without step number 1.
Actually, that makes a lot of sense, because that's one of the things that I try to do at work. So whenever I go into my office, I try to just sit down and knock out whatever I have to do right away. And maybe I don't get the whole thing finished right away, but at least I know that I stay focused or locked in for a while. So that's one of the things that I have been doing without even knowing that helps.
Sometimes, so one of the interventions for ADHD, pharmacotherapy, that could be a little controversial. Do you have any feelings towards that?
Not necessarily. So I was prescribed medication for it, but I'm not necessarily on it all the time. Just because I don't like the way it makes you feel, but not necessarily I don't lean one way or the other.
One thing I like to tell my patients is we're not pill pushers. We're not going to say you got to take these meds, and if you don't, it's against medical advice. At the same time, we're not going to withhold something that could really help you get to these next steps. It's all about a balanced approach. At the end of the day, more good has to come out of it than any bad or any side effects.
Yeah. So now that we have went over all these things, what advice would you give to somebody else who is trying to become a gym professional, whether it is in the same career line as yours or something different?
So I'll speak for behavioral health in general, or the mental health field, one and the same. I'd say think about what kind of work you would want to do on the day-to-day, because most of what I can do with the doctorate can also be done with a master's, whether it's in clinical social work, whether it's in counseling, school psychology, that basic day-to-day hand-to-hand, person-to-person psychotherapy. It's really only certain psychological assessments, perhaps testifying as an expert witness in court. Those are the positions that are a little more difficult, where you need the doctorate for that extra oomph. But everything short of those, there's a lot of opportunity and different avenues to work with people in a psychotherapeutic manner.
What were the exact steps that you took to get to where you're at? So what was your career path after high school?
So after high school, it was about 3-4 years of undergrad. Then I got a master's, which was 2 years. My doctorate program on its own, I believe, is 5 years, but they let me transfer some credits in. So it was about 6 years altogether for the graduate program. Afterward, I did an additional 2 years on my own for a postdoc. Now, that's not necessary, but it really gives you a leg up as far as developing a network, developing a specialty, which can be very helpful early on in your career when you're just starting to get established.
Okay.
So 6, 7, 8, 9, 10, 11, at least a decade under your belt.
Okay. Is that how long it took you? A decade?
It did.
Do you feel like the school choice that you made, as far as the school that you went to receive your doctorate, mattered to improve your career?
I think it certainly helps. You know, name recognition is powerful. Sometimes it comes down to access. They see a dazzling, fancy name and they don't ask any further questions.
Okay.
It can be helpful, but it's not the end-all be-all. So for me, my doctorate program, it's a PsyD. PsyD programs, doctorate in psychology, they're notoriously less competitive than a PhD, which is a doctorate of philosophy. Now, they're both competitive. PhDs are more for research, less for clinical. PsyD's more for clinical than research, but at the end of the day, both can do the same thing. So my grades, how did I do in undergrad? Well, they were satisfactory, but nothing really to write home about.
Okay.
So I didn't have that 1% of the 1% level of competitiveness, but I was still there to compete and get in and be given this opportunity. Now, once I had that opportunity, I tried to make the most of it. I knew that I had to stand out in order to make the most of what I was given. So at my program, it was a general school, William James, but they were able to get me in with Mass General, they're the teaching school, Harvard. They got me in for a year with Tufts Dental. I was working in the temporomandibular pain center, chronic facial pain. And I had a diverse experience that I didn't even know was possible until I was giving it my all every single year.
Sorry, what was that you mentioned? Temporomandibular? What is that?
Oh, sure. TMD. It's a type of chronic pain that's in the face. Colloquially, it's like the back pain of the face. There's this one surgeon, Dr. Scrivani. He essentially calls it that, where it's a very diffuse chronic, meaning it's longer than 3 months. And it's very difficult to treat into remission, even though the symptoms can still be treated.
All right, so we're going to play a quick game. So in this game, you're going to let me know what you would do if you weren't doing what you're currently doing.
Mm-hmm.
But you're not going to tell me. You're going to draw it out, and I'm going to guess what that is. So place it here. And then draw it out for us.
Let's see.
Oh, lawyer.
Boom.
Okay. Why lawyer?
I think attention to detail is important when it comes to what my patients will tell me. Sometimes, for my own personal notes, I'll even write exact quotes.
Okay.
It's really easy to assume what our patients might be feeling, but if we don't ask them, we could be on an entirely different trail. So it does them a disservice if we don't ask them the same questions again and again. Think things like suicide, for instance. We could easily assume, nah, they're fine. They're not going to hurt themselves. But if we don't ask that question, we're not going to get any closer to finding out if they are.
Okay. So you have a doctorate, and when you went into school, what made you go towards psychology instead of a lawyer degree?
What made me go into psychology? I think just getting to work with people one-on-one.
Okay.
There's a variety of options, whether it's being able to develop psychometric tests that could be used for assessment, working with people individually, having opportunities to teach. I would have never thought I'd be able to teach med students, and here I am with that opportunity given to me just 2 years ago.
Okay, that's awesome. All right, no, well, thank you very much for your time. It was very nice meeting you.
Hey, thanks for having me.
Oh, yeah?